Hi, I'm Gary Bebow, CEO of White River Health System, and this is the December CEO Connection. As my guest today, I have Shailendra Singh, a rheumatologist who recently joined our medical staff here in Batesville. And I think it's really helpful for us to introduce him, and particularly since he's in a new specialty that we haven't had previously, the field of rheumatology. So, Dr. Singh, I'm so pleased to have you here, and I'm so glad you chose to join us here. Tell me a little bit, what was there about White River Medical Center in Batesville that made you decide you wanted to come here?
Well, thanks for the welcome. I was The reason I chose Batesville was first of all, interviewing here. I really like everyone, talking to everyone, and realized that there's no rheumatologist in Long area, and probably this place needed me.
Yeah.
So,
Well, tell me exactly what is the field of rheumatology, and what's that specialty include?
so rheumatology, as you break about, is rheum and plus ology means study of rheumatic diseases, um, which includes a lot of different musculoskeletal or diseases with the joints, muscles, blood vessels. To put it in the few of the common diseases, rheumatoid arthritis, that is from where it derives its name from, and vasculitis, lupus, seronegative spondyloarthropathies like ankylosing spondylitis, and these are few to name. Polymyalgia rheumatica, which is common in elderly people. So few of the diseases. So basically, musculoskeletal diseases which have inflammation going on in the joints, in the muscles, in the blood vessels. So to put it in easy term, that would be the simplest explanation for that.
So you started what, in September? Was that? I think that's the beginning of September is when you started.
Yes, September 2015.
And so you probably see a lot of old people like me in your practice, and I'm sure in this community there's probably a lot of need for. I bet you've been busy, haven't you?
Yes, I've seen all age groups, not just elderly. Uh, Inflammatory diseases are common in both young as well as elderly. More elderly, more commonly we see non-inflammatory kind of arthritis like osteoarthritis, which is very common. Everyone which almost 50 plus will at some point get some amount of arthritis in the joints, and to the point that by 70, 80 years of old, 80 to 90% people have symptoms of osteoarthritis. So it increases with age. That is one of the. Besides that, there are a lot of inflammatory diseases we see in elderly, including polymyalgia rheumatica, vasculitis like giant cell arthritis we see very commonly in people who are 50 plus. So hallmark of those is there is inflammation going on inside the vessels or the joints. Rheumatoid arthritis can also, late onset rheumatoid arthritis is also, I've seen a lot of people with that here in Batesville. And a lot of people who have had this disease for several years and has not been able to see a rheumatologist in the area because earlier there was none. And they are feeling really well when we start them on treatment, and we have wonderful results.
I bet you've had some good results. I bet you've had a pretty good variety of types of patients up here too.
Yes, I'm seeing all sort of diseases, including arthritis. Rheumatoid arthritis is the commonest. Osteoarthritis. Beside that, vasculitis, adult onset Still's disease, lupus, and to name a few, and a lot of seronegative spondyloarthropathies.
Now, so the best way for folks to get in to see you, what's the best way, and where's your office located?
My office is located right in the hospital circle, 12 hospital circle, and the best way to reach me is by phone, which would be 870-262-1500. You can call and make an appointment. Would need a referral from a primary care before you make an appointment. And yeah, we are seeing new patients, and
Well, we're really pleased to have you amongst us. We've been looking forward to having you come aboard, and I'm sure you're going to have a great practice and really a fulfilling career here. So thanks for coming with me today.
Thanks for having me here.
Our standard of the month for December is involved. It's part of our PRIDE overall standards of behavior. So I is for involved. When you think about being involved, it's really important for you to get involved in what we have going on here at the hospital. Be positive, show your commitment, really be an active participant at the hospital. So during this month of December, try to focus in on that involved part of our standards. We have 2 employees of the month, one at Stone County Medical Center and one at White River Medical Center. And what really stands out on both these has been the length of service at our 2 institutions. At Stone County Medical Center, we have Kathy Hanna, a CNA that's been with them for 23 years. She works on the 2nd floor in the nursing and really is well known for her commitment to coworkers. So really pleased to recognize Kathy as Employee of the Month for Stone County Medical Center. At White River Medical Center, Pat Reynolds in our pre-service unit was chosen for Best Demonstrating Prompt Service. She's been with us for 33 years, and so I know for all of us that have been at White River for any length of time, we all know Pat, and she's very well deserving of this recognition. So if during this next month you see Kathy over at Stone County or Pat at White River, please recognize them and express your appreciation. Over the past several months, we've really been fortunate in recruiting new physicians to join our medical staff. And in December, Dr. Russell DePonio will be joining the White River Family Medicine Clinic out on White Drive, previously the practice of Dr. Lackey Moody. Dr. DePonio is an internal medicine physician, and for the last few years he's been practicing in Newport. So we're really going to welcome him onto the medical staff, and so when given the opportunity, please welcome him. Each month we hold a community health education event, and on December 8th, Dr. Stoyaglu will be speaking on heart disease. It will be in the Josephine Ray Rogers Conference Center and at noon, and so if you have some time on December the 8th, I hope you'll drop by and listen to Dr. Stoyaglu speak on heart disease. Each 6 months, I have an employee forum where I invite the employees of the hospital to come and hear about how the hospital's doing. And on December 9th through the 12th, and then on December 14th, I'll be having regular sessions that give you an update on how we're doing in our different pillars in the areas of service, in the areas of quality, people, finance, and growth. And so come over and come to one of the sessions and find out how the hospital's doing. Also, during that employee forums, I'll have some other timely topics that will be of interest to you. So make a point to come by and participate in the employee forums. There's 2 policies that I want to bring to the attention of employees at the hospital. The first one is our employee parking policy. Throughout our campus, we have areas that are green striped and areas that are yellow striped. Now, the green striped are for employees, and the yellow striped are for visitors or patients that visit the hospital. So, I've noticed over the last several weeks that we've had a lot of employees parking in the yellow striped areas. I really ask you to refrain from doing that, because you see those are located so that patients and visitors have easy, direct access into the facility so that we can provide their care better for them. And so please, I'm encouraging you to refrain from parking in the yellow areas, and instead there's plentiful areas for the green striped. And so help me out by parking in the proper locations. Recently, we've adopted a policy of no weapons on campus at White River Medical Center and Stone County Medical Center. A weapons policy is you can argue both sides on whether we should allow weapons or whether we shouldn't. But after giving a lot of research and finding out what other hospitals are doing, we've taken the position that no weapons will be allowed on the hospital. Now, I know that several of you may have concealed weapon permits, as I do, but for the overall benefit of the safety of our institution, we request that only those that are armed officers of the law they'll be allowed to wear weapons or have weapons on campus. So if you have a weapon, leave it at home. Don't bring it to the facility. And I'd appreciate your complying with this policy. This being December, it's appropriate for me to recognize the employees for the great work that they did during this 2015 year. We've recognized that through two means. Principally, one is the employee bonus, where we met some of our metrics, and as a result, we were able to award a bonus at White River Medical Center and Stone County Medical Center. By the time you view this video, you will have already received your bonus checks for that year of performance. In addition, we'll be handing out turkeys and other gifts that you may have selected as a part of the Christmas holidays. So I hope to see you there when I'm participating in the handouts. And if not, I certainly wanted to thank you all for the hard work you've performed this last year, and I hope you all have a blessed and happy holiday.